In this paper we present PREVIS, a system for predictive visual analysis of anatomical variability for radiotherapy decision support. Radiotherapy requires meticulous planning prior to treatment. The radiation treatment plan is optimized with regards to organ delineations on a pre-treatment CT scan of the patient. However, the treatment usually lasts several weeks and anatomical changes may occur while the patient is being treated. Consequently, the radiation dose delivered to organs may deviate from the plan and cause side effects. In PREVIS, records of during treatment changes from a retrospective imaging cohort are employed to infer expected anatomical changes of new incoming patient and assess the most suitable treatment strategy. To support this, PREVIS focuses on four main tasks in the following analytical workflow. We start with retrospective analysis and partitioning of the cohort of past patients with respect to anatomical similarities and intra-treatment changes. New incoming patients are then matched to the past patients. This is followed by pre-treatment modeling of the anatomical changes of the new patients based on observations of past patients. Finally, treatment strategies for the new patient can be assessed with respect to anticipated anatomical changes. To support the cohort analysis, we first employ probability density-based 3D shape descriptor to get a low-dimensional representation of organ shapes at individual treatment time steps. These are chained to represent whole anatomy at the given time step. To describe the patient, we aggregate the time steps using mean and standard deviation. In this way, we capture for each organ the average shape and variation, which can be reconstructed into coverage probability volumes for the given patient. The patients are grouped into clusters using hierarchical clustering. We employ two views to show the overview of the cohort data, the overview table and the Radvis plot. In the overview table, patients are shown in rows, and the columns correspond to individual time steps. Color bars are used to indicate clusters of individual patients. The cells of the table show the difference of the anatomy at individual treatment time steps to the anatomy captured in a planning CT. To show the results of the clustering and an underlying distribution of the patients in greater detail, we employ Radvis Plot. Here, the clusters are represented with the thumbnails of the cluster coverage probability volumes placed on the circumference of the circle. The patients are represented as points within the circle, where the placement of point indicates similarity of the patient to individual clusters. When new patient is loaded into the system, he is added to the Radvis plot to show the similarity to the clusters and other patients. This is accompanied by more detailed hierarchy view. In this view, the past patients are arranged in the hierarchical structure resulting from the clustering. The color of the cells indicates similarity of the shape of individual organs of the new patient to the clusters and patients represented in the hierarchy. The size of the cells encodes similarity in shape variability. The system automatically selects the cluster of most similar patients for predictive modeling. However, users can browse the patients and make changes in this selection. The most similar patients can serve as an input to a statistical modeling that predicts organ changes for the new patient. We first compute mean shape descriptor for each included patient. Then we compute the corresponding time step specific deformations from this mean. We employ principal component analysis to find the main modes of variations in these deformations. By sampling along the identified eigenmodes, we generate new deformations. These are applied to the mean shape descriptor of the new patient. From the generative model we compute new mean coverage probability volume for the new patient. The anticipated changes can be inspected in anatomical views consisting of three anatomical 2D planes and a 3D view. In 2D views we show the 10, 25, 50 and 75% coverage probability levels. The standard deviations from the mean coverage probability volume are shown on hover. This view can also be utilized for spatial comparison. For example, we can compare the generated coverage probability model with the anatomy captured in the planning CT of the new patient. Finally, we can assess the treatment plan for the new patient with respect to the modeled coverage probabilities. If multiple treatment plans are available for the patient, they can be compared in terms of difference in spatial dose distribution. To evaluate treatment plans with respect to numerical guidelines for the acceptable dose limits for organs, dose-volume histograms are typically used. In our system we compute and show the dose-volume histograms for the 4 coverage probability levels of the inspected volume. We link them interactively with the anatomical views. Dose-volume histograms serve as an input to normal tissue complication probability models. This is another method for assessment of treatment plans. These models are associated with multiple parameter uncertainties that affect the shape of the model curve, resulting in vertical confidence intervals. Horizontal confidence intervals then reflect the anatomical uncertainties from our coverage probability model. These views together with the generative model support the analysis and assessment of treatment plans for new patients in predictive manner. Thank you for watching.